The fabric of Pahrump is weaved with a supporting and caring community, often resilient as the desert sun. Yet, beneath its vibrant surface, like almost every community, many of us silently battle the shadows of substance abuse. Addiction impacts everyone at some level, directly or indirectly. We all feel its impact. Yet many people face this battle daily. Substance abuse is a national epidemic, but its impact is felt acutely in rural communities like ours. Unlike urban areas, where resources may be more readily available, rural regions often face unique challenges that amplify the devastation of addiction. Studies show that people in rural areas are more likely to misuse prescription opioids and methamphetamines, leading to higher rates of overdose and death. In fact, according to the CDC, opioid-related death rates in rural America have quadrupled since 1999, surpassing those of urban areas. The strain extends beyond individuals. It affects entire families. Healthcare systems in rural areas are also under immense pressure. With fewer facilities and practitioners, local hospitals and clinics struggle to handle the influx of substance-related emergencies. This can divert critical resources away from other pressing health needs, impacting the entire community. Local law enforcement also bears the brunt. In Pahrump, over 70% of all arrests are tied to substance-related offenses. This places immense stress on already stretched budgets and personnel, diverting attention from other community needs. The cost of addiction is steep: broken families, lost productivity, and communities left struggling to heal. But while the statistics are sobering, they are not the end of the story, not by a long shot. Because where there is challenge, there is also opportunity. An opportunity to restore, rebuild, and reclaim lives. And that's where Living Free steps in. Amidst these challenges stands a beacon of hope: Living Free Health and Fitness. Established in 2013, this impactful non-profit organization's mission is treating addiction with whole health solutions. Living Free serves Pahrump and our rural neighbors. Since its grassroots inception, Living Free CEO Shelley Poerio has built a treatment and recovery programs positively impacting hundreds of addicts, along with playing a key role in local support systems dedicated to long-term recovery.
There's a lot of people who relapse, and I was one who relapsed many times myself, so I understand it. But when you see somebody finally get it and then they really move on, it's really all worth it. All the time and effort and all the cynicism and the things that go along with it from time to time, and the frustration, it's far outweighed by the successes.
Living Free is much more than a valuable treatment and recovery resource. They have built an on-site cafe, serving a delicious menu to a steadily growing customer base. In this past year, Living Free Gym opened not just to serve local fitness seekers, but also providing an invaluable tool in recovery, greatly improving the odds supporting long-term sobriety. This treatment model is a very unique approach, especially in a rural Nevada community. Shelley credits a higher power for Living Free's evolution.
I think it came from God. I mean, I'll be honest with you, it was divinely inspired. I felt a desire to move to Pahrump, and that was personal. And when I got here, I recognized that there were not a lot of resources for people, and I just wanted to contribute in some way.
We also have a couple of groups where we talk about exercise's role in recovery and also nutrition's role in recovery. And that's where we talk about like how your diet affects your recovery as well. So these are all components to this program. So in her opening up the cafe and then the gym, I was like, this is awesome. And we also
Living Free offers SAPTA-certified intensive outpatient, early intervention, and prevention services for adults and adolescents. Their highly credentialed team includes licensed alcohol and drug counselors, marriage and family support, clinical social workers, and peer support. In collaboration with essential services such as the Drug Court Program, medical and mental health outreach, a multi-pronged effort is needed to foster long-term recovery. Recognizing the importance of a supportive environment, Living Free provides SAPTA-certified transitional living programs if the individual meets eligibility mandates. These 4 homes offer structure, supervision, and a sense of community, essential for sustained recovery. Highly structured living environment supports women who are pregnant or have children, and separate transitional homes are essential to the women and men in recovery. With dozens of Valley residents receiving substance abuse treatment or in recovery, whether by self-referral or through the legal system, it's evident every day that Living Free plays a crucial role in the fabric and overall welfare of our community. Combined with other local partnerships, including drug court, mental health, and job readiness training, there is true collaboration in limiting service gaps and building support for substance abusers and drug offenders. Several former clients have come full circle by excelling in their program and earning staff positions on the Living Free team. Another testament to the true value Living Free can deliver.
Because I did this program, because I lived what our clients go through, my client, I can understand where they're coming from, because I've done a lot of things, and I've been those people where, I had a lot of guilt and shame, and that can be a big trigger for a lot of our clients.
There are endless challenges Living Free confronts on a regular basis due to their various treatment and recovery programs, along with the operations of a cafe and gym. This requires not only sound fiscal management and organization, but also navigating the oversight of an often dysfunctional population they pledge to serve. At the end of the day, Shelley and the Living Free family simply try to remember where they came from.
I think just the aspect of doing good for our community. It might sound cliche, but I don't know. It's the giving back. It's the paying it forward.